Hello, and thank you for watching the Community Health Mentor Program info session video. Today we'll be covering the most common questions about the program and talking about the next steps to getting involved. The Community Health Mentor Program was created to give students from different healthcare disciplines an opportunity to connect and learn from one another. But most importantly, to offer future healthcare providers a chance to build meaningful relationships with their local community. It's a relationship-based way to promote passionate and informed healthcare advocates. The vision of our program is to prepare students to radically improve the health of our communities through innovative approaches to interprofessional student education, starting with team-based experiences over time that are centered around community mentor relationships and that explore the social determinants of health through the lens of their community mentor's life. It really gives students the opportunity to talk about all of the things that impact someone's health that aren't necessarily directly associated with clinical care, like the social communities that we're from, our access to healthcare, our education, or geographical location. So the students from different disciplines come together from NAU's occupational therapy, physical therapy, and physician assistant programs, as well as University of Arizona's College of Medicine, Phoenix. And for the nutrition focus visit, ASU's nutrition students joined the team. So who can become a mentor? As long as you're an adult that's living with a disability or multiple chronic conditions and you have a primary care provider, you are eligible to participate in the program. If you're a caregiver for a loved one, you are also eligible to apply as a co-mentor team. It's not uncommon for us to have partners serve as a mentor team for a group of students. A few conditions are listed on the slide, but there aren't specific conditions that are required to be able to be a mentor. We're really just looking for community members that can share experiences engaging with many different types of healthcare providers that know what it's like to try and coordinate care across different teams and potentially different healthcare organizations. We require that our mentors have a primary care provider that they know how to contact. It'll be key for you to have licensed clinicians to turn to when you have questions specific to your situation. We've put stars on 2 of the criteria on the slide because now that we're living in a COVID-19 world, these visits are no longer happening in person. So there's a lot more flexibility about when those visits happen. So you could reschedule for days other than a Wednesday or the Wednesdays listed on our website. We do provide closed captioning or ASL interpretation if that's something that mentors need to participate via Zoom. We do plan to continue with Zoom meetings for the foreseeable future. We are shooting to get back to in-person meetings. So if you aren't able to meet with students within 25 minutes of downtown Phoenix, that may not actually be a problem. So please do go ahead and reach out to us and we'll work to find a place for you in our program. So why would anyone want to become a mentor? Well, the main reason that people tell us that they enjoy this experience is because they really want to give back. This opportunity really allows community health mentors to shape the next generation of healthcare providers. You can really represent your community or the communities that you identify with and help create cultures of compassionate healthcare and strong patient-provider communication. You also have the opportunity to learn about a variety of health professions and community resources. In many cases, the students will be sharing new community resources with you, but many of our mentors also end up sharing a lot of resources with the students that they can then take into their clinical practice in the future. It's also a great way to strengthen your leadership and advocacy skills and build meaningful relationships. The mentor's role in this program is to share your personal experiences and thoughts, things that will help the students learn what helps patient-provider relationships and what takes away from them, what leads to high-quality team-based care, and what increases access to healthcare. Usually in these visits, you'll participate in activities. In some cases, that'll be a survey or you might give a tour of the modifications in your home. The visits all have a unique focus or theme. The first visit is all about getting to know you and your medical history, And then you'll work through various topics like community barriers, which might include environmental barriers or more nuanced things like prejudices and biases. And then you'll move on to other topics like home safety and nutrition. The student role in this program is to really just listen and learn from the mentor, but also from their peers. This program isn't meant to offer community health mentors direct clinical care, so the students do not engage in a patient-provider relationship with their mentor, and they don't provide any direct medical care or rehabilitative advice. If you're interested in participating in this program as a community health mentor, the next steps would be to reach out to us and we'll schedule a phone call. That interview will be, an informal conversation about why you want to be a mentor and what's your background generally. And then after that interview, you'll complete a background check and participate in the mentor orientation. These are the dates for the program. All visits typically happen on Wednesdays. Now that we're living in a COVID-19 world, there's a lot more flexibility, and if something happens, it's not uncommon for students to reschedule a Zoom meeting for another time. If you have any questions, feel free to send us an email at pbc-mentor@arizona.edu or call one of our coordinators.